Hello, my name is Carin and I'm a PhD student at Karolinska Institute in Sweden. And this is Dr. Angelina Kakooza, and she's a pediatric neurologist at Makerere University in Uganda. Together with our co-authors, we have written the article Impairments, Functional Limitations and Access to Services and Education for Children with Cerebral Palsy in Uganda, a population-based study. And this study is part of a large population-based research project on children with cerebral palsy in Uganda. And Dr. Angelina, you are one of the PIs of this project. So can you please explain why it's so important to do research on children with CP in Uganda?
It is indeed very important that we do research in this highly neglected group of children. We know that this is the first ever population-based study on cerebral palsy in children in Africa. We have not studied the functional limitations, healthcare seeking practices, and functional limitations in these children. We know that they are a highly stigmatized group, and yet we know that from studies done in the Western world, if you identify these children earlier, a lot can be done for them. So it's indeed a very important study for Africa and the world at large.
We did a 3-stage screening of over 30,000 children in a rural area of Uganda, and we found 97 children with cerebral palsy. And we found that the younger children were more severely impaired than the olders, and this could probably be because of a high mortality among the more severe cases of children with CP. And 37 of the children could not walk, and only 3 of these had wheelchairs. And none of the other children had any kind of assistive devices for hearing, talking, seeing, or walking. And there was very few children that attended school, only 1/3 of the children. And we also saw that care seeking among caregivers were very low, and this was related to lack of knowledge, having insufficient funds, and also having lost hope. And when we looked at the Ugandan children, we saw there was a lower development of mobility and self-care compared to a Swedish cohort of children with cerebral palsy.
We therefore can conclude that children with cerebral palsy in Uganda lack assistive devices, they lack access to education, and they also lack access to health care. And we know that this contributes to their poor development in mobility and self-care skills. Therefore, this article highlights the need to develop and enhance locally available interventions to help this highly neglected group of children.
Thank you for watching, and we hope that you will read our article. We want to thank our co-authors, and we also want to thank our huge team in Uganda who has contributed so much to this article.
Thank you.